Good afternoon, everyone. So like Julia said, my name is Caitlin McCauley. I'm a respiratory therapist and a respiratory educator with the Cardiac and Pulmonary Rehab Program here on PEI. I've also been on the board of a PEI Lung Association for about 6 years, and I just stepped off in the last year. So this is a very great association that's near and dear to my heart. So I'm very happy and pleased that you invited me today. So our agenda for today is the introduction, just a little bit about me, which I've already done. We're going to talk about what is COPD, some of the symptoms of COPD, how we can live well. So what are some of the things that we can do to have a good life, even though you have a diagnosis of COPD. We'll talk briefly about how to get diagnosed with COPD, some community resources, and then we'll talk about what we talked about. And then at the end, like Julia said, we can ask any questions that you have. So we use the term COPD often, and you might not even know what COPD stands for, but COPD stands for chronic obstructive pulmonary disease. So what that means is the C, chronic, is long-term, meaning it doesn't go away. It is something that you will have. O stands for obstructive, so where something is partially blocked. P stands for pulmonary, which is our lungs, and then D is for the disease process. So if you hear COPD, it stands for chronic obstructive pulmonary disease. So you might have been told, if you've been diagnosed with COPD, that you have chronic bronchitis, or that someone has told you have emphysema, or they might have just said you have COPD. So COPD is kind of an umbrella term that includes both bronchitis and emphysema. So if a doctor has said you have emphysema, you have COPD. Or if they've said you've had chronic bronchitis, you have COPD. And we're going to break those down a little bit now so you can understand that. So on this slide in front of me, you'll see, or in front of you, you'll see pictures of two of the airways in our lungs called bronchial tubes. So you can see here. Can you see my arrow on the screen? So this here is a normal airway. So it's a tube, our air tubes are just like this. And when we breathe through them, it's easy if you have airways like this. What happens with obstructive bronchitis is that they get tight, and it's much more difficult to breathe through an airway that's this small versus this small. What causes our airways to get smaller is inflammation or swelling. So that is what happens with chronic bronchitis, is that we get swelling in our airways. What can happen is we can produce more sputum or phlegm in our airways, and then that can lead to more obstruction there, which makes it much harder to breathe through. So some symptoms of chronic bronchitis are increased sputum, so you're coughing up more stuff, you cough more, and you may hear yourself wheezing, which is kind of like a whistling noise, and shortness of breath. So those are the most common for symptoms of chronic bronchitis. The next part is emphysema. So in the bottom of our lungs, we have these little air tubes called alveoli, and this is where we take oxygen in and we take carbon dioxide or waste out of our lungs. What can happen with emphysema is that these small little tubes at the bottom of our lungs can get damaged, and when they get damaged, we can no longer get as much oxygen in or as much of that waste product out. So they become stiff, and then if you're trying, it's like blowing up it's harder to they get stiffer and stiffer, and then you'll actually get air that traps in there, and then we can never really empty your lungs out. And then that can lead to us feeling short of breath. So the #1 symptom of emphysema is shortness of breath. And because we're not getting as much oxygen, we're not getting as much energy, so then that can make us feel tired as well. So some general symptoms of all chronic lung diseases include shortness of breath. So what happens whenever we feel short of breath is that can make us feel anxious. Once we feel anxious, we can get more short of breath, which can cause us to feel scared and unsure of how we're going to be able to catch our breath back. That can cause us to get exhausted, which then can make us more short of breath, which can make us more anxious. So it can be a cycle that can go back and forth. But in the beginning, you might not notice your shortness of breath to be too bad, but then as your disease progresses, your shortness of breath may get worse. So I am going to teach you a little bit of some techniques to help prevent, when you do get short of breath, what can you do? If you're lifting something, what can you do so that you don't get as short of breath? Cough and mucus production. So cough is one that can, that might be your first symptom that you notice, is that you're coughing more and that you're spitting stuff up. So every morning in the mornings, you can cough up stuff every day for 3+ months, even when you're not sick with a cold or something like that. Chest tightness. So our chest you might feel tighter when you try to take a bigger breath and you try to expand your lungs more, then your chest might feel tight. It doesn't feel like your heart pain, but it just feels harder to take a bigger breath in. Wheezing. Wheezing is kind of a whistling noise, and it's that picture I showed 2 slides back where you have narrowed airways. So it's trying to push air through a narrow airway, and it makes a whistling sound. And you may be able to hear that yourself, or if a doctor or a nurse or a respiratory therapist is listening to your lungs, they may be able to hear that wheezing through the stethoscope. Tiredness, that's a big one. Again, if you're not getting as much oxygen as you need, that can, your body doesn't have as much energy, and then you can be tired. You may also just get tired from doing more simple things that you never used to, but now all of a sudden you're more tired and short of breath. And anxiety, which I touched on before. Anxiety is a very common symptom of a chronic lung disease, because if you feel short of breath, it can make you anxious, and then therefore you don't want to do things because you don't want to get short of breath. So we want to try and break that cycle of feeling anxious so that you can actually do the things that you want to do. So what are some things that can make our breathing worse? So there's lots of things that kind of affect our breathing. And some things we can control and some things we can't control. So the first one is indoor pollutants. So we think about the things inside our homes that we can control. So certain scents can really bother people more than others. Candles, perfumes, dust, cigarette smoke. So all those are things that indoor we can try to control if we just, limit the amount of those indoor pollutants. Some of our outdoor pollutants we can't control. Unfortunately, on PEI here, we don't have to worry about smog and bad air quality generally, but if you live in a bigger city, then those are some things that can affect our breathing that we have to stay inside for. And we want to try to avoid those as much as we can so that we don't flare up our lungs and cause us to have an exacerbation or a flare up. So the next one is a change in temperature, which we have been experiencing in the last few weeks, particularly. Unfortunately, obviously, we can't change the environment and the temperatures outside, but we just need to learn how to dress appropriately in layers. So when it's cold outside, dressing warmly and covering your nose if possible. So right now we're all required to wear masks when we're out in public, but if you're going for a walk or doing something outside and it's cold, it's helpful to wear a mask or even a scarf over your nose and mouth, and that can help warm the air even before you breathe it in, which can then make you not feel as short of breath. When it's hot outside, which unfortunately right now we're dealing with the cold, not the hot, but when it's hot outside, you want to try to avoid doing things outside that you don't have to during that peak times during the day. So, you know, that mid-afternoon when the sun is the hottest, we want to try to avoid doing things like gardening, or maybe you do your walk in the morning or late afternoon versus lunchtime when the sun might be really hot, and then the more hot you get, maybe the more short of breath that makes you feel. Humidity is a big thing, so when it's really humid outside, it's very difficult for us to breathe if you have lung problems, because our airways can get filled up with more of that sputum or the phlegm, so we can't clear it as easy. So we also encourage you to drink as much water as possible during, especially during the summer, unless your doctor has told you otherwise. But that will help to keep that phlegm thinner, so it's easier for you to breathe. Wearing light clothing when it's hot outside and a hat can help as well to reduce some of that heat problems. The next thing is respiratory infection. So that is something that can really affect our breathing. As we know, if we have a flare-up or we're exposed to someone else who has an infection and then we get an infection, it can really affect, if you have a lung disease, how well you do with that infection. So right now we're all staying home and we're not going out in public, but during quote unquote normal times, we want to avoid anyone who has a respiratory infection, a flu, a cold, anything like that. So that might mean, you know, your family member has a bit of a cold and you say, okay, I don't want to visit from you today until you're feeling better, or I'm not going to come visit you because I don't want to get anything, or you ask them not to come into your home when they're feeling unwell. And because an infection can affect you a lot more than it can affect them. Very important these days that we're washing our hands very frequently. So when you're out in public, we want to make sure that everyone's using the hand sanitizers. When you get home from a store, you should be washing your hands. I always tell people to have hand sanitizer just in their cars, so that as soon as they get out of a store, they can just use hand sanitizer and wipe their hands down. Keep it in your purse and have it available as much as possible so that you can use it and it's right there. You yourself, as well as anyone else you may be living with, should get a flu shot every year. The flu shot is available to all islanders free of charge, so you just have to make an appointment with either public health or you can walk into any pharmacy and they will give you a flu shot free of charge as well. And there's also there's the pneumonia vaccine, which is something that is available on PEI to people who have lung diseases. And so I always suggest people to talk to public health, and if you haven't had one, talk to your doctor about it. And then if you have had a vaccine pneumonia vaccine before, and you're wondering if you need a new one or another updated one, just talk to public health and they can go through your vaccine records and tell you if you need one or not. And lastly is emotions. So as I briefly mentioned before, when we get anxious or stressed, that can make us feel short of breath. That can also put us into a flare-up if we have, if we're having a really stressful time in our life and we're really, really anxious, that can actually cause your breathing to be significantly worse. So trying to control those emotions as much as possible and being realistic, I know that sometimes life happens and there's things that we can't control, but using some of the breathing techniques we're going to talk about when you're having a stressful time so that your breathing doesn't get out of control too much that causes you to have a flare-up. So what are some of the things that we can do besides what we just talked about to stay healthy? So we're going to break some of these down individually, but as you can see on my screen here, there's lots of things that we can do to stay healthy and live well with COPD. I'm going to talk about medications in a few minutes, but adopting a healthy diet is very important. So if we are, whatever we put into our body is fuel for our body. So if we're eating healthy vegetables, fruit, meats, all of those things, then our body is using that for energy, and then that can improve our quality of life. The more energy we have, the more we're going to want to get out and do things, which is good for us. We can exercise better or be more physically active, and that can help us prevent infections. So we want to be able to adopt a healthy diet as much as possible. And I know that can be difficult. We do have dietitians in our primary care networks here on PEI. So what that means is that you can book an appointment with a primary care dietitian, and then they can go over your diet with you to make sure that, okay, what areas can we work on to get a little bit more vegetables in, or more meat or protein and things like that. So that's something that I do recommend to clients, is to, if you're struggling with your diet, then dietitians are great resources. And sometimes it's not even about losing weight, it's about gaining weight. For some people, they can't gain enough weight, and if they don't have enough weight, then they have low energy. So that's important that we have a healthy diet. We're going to talk about exercise and quitting smoking and complying with meds on the next one. And there's a nice plane at the bottom here, but unfortunately we're not going on trips right now. But it is important to plan for, plan to do things that we enjoy doing, because if we enjoy doing something, then that makes us happier and that improves your overall quality of life. Sleep is another big topic that's very important. If we don't get a good night's sleep, then we can often lead us into having bad days. Also, sleep can have a big effect. If you're not feeling well, sometimes sleep can be the first signal that you're having a flare-up. You are waking up in the middle of the night because you're short of breath and you have to use your rescue inhaler. And so keeping an eye on, if you are waking frequently during the night, why is it that you're waking? So we're just going to talk about smoking cessation. So smoking is the leading cause of chronic lung disease, and approximately 15 to 20% of smokers will develop COPD. Quitting smoking is the single most effective treatment for COPD. So we can't give you one other puffer or medication that will have the same effect as you quitting smoking does. Quitting smoking greatly declines. So as we get older, our lung function goes down. It doesn't matter if you smoke or if you don't smoke, it just naturally goes down. But if you smoke, then it goes down a lot more quickly than if you didn't. So quitting smoking can help reduce that decline so it's not as fast and sharp as if you were still smoking. And we understand that quitting smoking is very difficult and it takes a lot of work, but it is, like I said, the single most effective thing that you can do for your health. There is resources here on PEI that we can offer for smoking cessation, and it has been proven that using counseling, so talking to someone about quitting smoking, as well as using pharmacotherapy like nicotine replacement, that that can help. Using those two together can be more effective than just trying to quit cold turkey. I will talk about the resources close to the end, but like I said, there is a program that you can join on PEI to get help with the nicotine replacement medications that you can take. So speaking of medications, we're going to talk about why do we need to take medications. And not everyone is going to be on medications when they are first diagnosed with a lung disease, but as the disease progresses, you may need to be put on puffers, or your puffers might need to change. So the goal of taking puffers and other medications for our lungs is to make sure that our lungs are working the best they can. And we want to slow the disease progression if we can. So that meaning we want to, if we take our medications properly, we stay active, then we can actually help to slow that disease progression so you're not getting as sick as fast. Puffers can help to decrease our shortness of breath, and then it can also help to prevent a flare-up. So you might have heard the term exacerbation, but that means flare-up, and that's a worsening of your symptoms that often requires you to take different medication like prednisone and an antibiotic to get over that flare-up. It's very important that you know a few things about your medication. So it's very difficult to remember all of the names and the dosages. So I always recommend to people to keep a medication list in their wallet, or take a picture of it and have it in their cell phone, or something that they can easily access. So if you go to a doctor's appointment or the pharmacy and they ask you your medications, you can just show them to it. And then you don't have to try to remember all of the names of it. But you should know what each puffer does and when you need to take it. So if you say, my blue puffer I use when I'm short of breath, then that you know that that's your rescue puffer. And then you take another one that you take every day, once a day, and that's the one that's going to help to maintain your lung function. And there is a presentation on puffers in a few sessions that they're going to go over all of the puffers with you and how to use them properly. Only 10% of people use their puffers properly, which is quite a low number. So it's very important that if you ever get a new puffer, that you ask the pharmacist, the nurse, the doctor, someone to show you how to use it, and then you show them how you use it to make sure that you're doing it right. Because there's no point of taking a puffer if you're not using it correctly. And if you're having trouble using your puffer, then you should tell your doctor or your healthcare provider, whoever gave you the medication, that it's too difficult for you, and then they can change it to something else. On PEI, you can also do a medication review once a year with a pharmacist, and what they will do is they'll make an appointment and then they'll go through all your medications with you and explain what they do and making sure you're using them properly. So I do also recommend all seniors and adults to do that, to make sure that you are on the right medication and you're using it properly. Exercise. So exercise can seem very overwhelming if you have a lung disease, because you may feel like, well, I'm too short of breath, I can't exercise. Exercise includes a lot of different things, and it's all about being active and moving. So you don't have to try and run or walk an hour a day. Maybe you break it into 10 minutes here and there, whatever you physically can do. The WHO, which is the World Health Organization, suggests that everyone get 150 minutes of exercise a week. So that might seem overwhelming to say 150 minutes. But if you break that down to 5 days a week at 30 minutes a day, it doesn't seem as intimidating. And then even if you break that 30 minutes a day down into 3 10-minute sessions of doing something, then there's your 150 minutes. And at the beginning of starting to exercise, if you're not normally an exerciser, then it's important to start slow and move forward. Don't try to do, you know, an hour at once, but go slow. And also find something that you enjoy doing. So what I might like to do might not be something that works for you. So it's important that you find something that you like to do. So there's certain things that can be considered activity. Household chores can even be considered activity. Sweeping the floor, vacuuming, those things take a lot of energy. So those are activities that, you know, give you some health benefits as well. Walking is important, dancing, yoga, chair yoga. There's a lot of different things out there that are available to do. So you don't have to think of just walking as being the only, or lifting weights as being the only exercise that you can do. There's so many more things out there to do. And like I said at the beginning, just because you have a chronic disease doesn't mean that you can't participate in exercise. It just means that you might need to modify it a little bit and do things in shorter time frames. But being active is very, very important. So sometimes people ask, they say, well, if I'm short of breath, how am I supposed to be active? But the more you exercise, the less short of breath you can be. So we're going to talk about how we can manage some of these symptoms of COPD or chronic lung disease. So we're going to talk about Purslip breathing, some body positioning, and coughing techniques that you can use to help. So I don't know if any of you guys have heard of Purslip breathing, but it's it's a great tool to use when you're feeling short of breath, and even when you're not feeling short of breath, it's a great thing to use to help practice breathing. So if you see at the bottom, it's smell the flowers and blow out the candles. So you're going to inhale for about 2 seconds, and then you're going to breathe out for about 4 seconds. So twice as long as you breathed in. So what I'm going to do is, and when you're breathing out, you're going to purse your lips together like this. So breathe in. And breathe out like that. So breathe in for 2 seconds and breathe out for about 4 seconds, and pursing your lips while you're doing that. And that actually, when you are feeling short of breath, if you can focus on your breathing and say breathe in, you can even count out loud. 1, 2, 3, 4, 5, 6. So even talking out loud can help to lower your shortness of breath, so then you can kind of catch your breath and start doing whatever activity that you were doing. It's very, very helpful to use this Purslip breathing when you're exerting yourself. So doing difficult things like climbing stairs, lifting things up. Those are all, it's really important to use this Purslip breathing during that. So I just mentioned climbing stairs. So a lot of people have trouble climbing stairs. Very important that you look at your environment when you're going to climb the stairs and make sure that there's no boxes or clothing, anything that might get in your way that might cause you to trip or fall or stumble that could be dangerous. So make sure your stairs are clear. And if you have really bad shortness of breath, you're going to stop at the bottom, take a big breath in, and then you're going to climb one step and stop, and then breathe in at the bottom, and then as you step up to the next one, you're going to breathe out. Okay, so that's if you have severe breathlessness. If you can do a few steps, what you're going to do is you're going to breathe in at the bottom, and then as you're moving up 2 to 3 steps or 3 to 4 steps, then you're going to breathe out and then stop at a landing and do the same thing again. So again, it's very important that you, when you're at your not moving, is when you're breathing in, and then as you're exerting yourself or moving, that's when you're going to blow out. And it seems like the opposite of what you should do, but we don't want you holding your breath while you are doing the hard work. We want you to be blowing out while you're doing the hard work. Same thing with carrying an object. So We recommend that you try to keep as much stuff on as close to your body as possible. So as much stuff off the floor as you can, so you don't have to bend down, because bending down can make you feel more short of breath. Now, however, there's going to be times when you do have to bend down. So again, you're going to, before you lift it, you're going to take a big breath in, and as you lift it, you're going to breathe out. So at the bottom, you're going to breathe in, and then as you stand up and carry the object upward, you're going to blow out. And make sure that you always bend your knees, as you can see in this picture, and to keep your back straight. So you don't want to be bending forward, you want to be bending at your knees. Coughing techniques. So I'm sure you all are very familiar with how exhausting coughing can be. So coughing can lead to a coughing fit, where we cough, 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 can be very exhausting, and it can lead us to feeling more short of breath. So some things that we can use with coughing. The first thing is to cough into your sleeve if possible. So when you're out and about and you have to cough, coughing into your sleeve prevents spread of any, if you have an infection or anything like that, or just to contain it, versus coughing into our hands. If you do have an infection or something, you can spread that easily. So everyone in the population should be breathing into their elbow when they cough. Huff coughing is a technique that you can use to help get rid of some of that sputum or that phlegm that's in our lungs. And the more stuff we can get out of our lungs, the better. So you want to try to cough as much of that stuff out as you can. And the more you cough out, then it can prevent your airways from getting more blocked, which can cause you to feel more short of breath. So for huff coughing, what you're going to do is you're going to have a seat in a comfortable chair. You lean slightly forward, and you're going to breathe through your nose, and then you're going to do some short, not forceful bursts of coughing. And what that's going to do is that's going to help to move the phlegm into our throat, and then for you to be able to cough it out. So it's like this. So just short little bursts. And if there is stuff in there, the first cough or the first burst should help to move it upwards, and then the second one should help to move it out. So, and I don't know if you can see here, I'll move this down a little, but I always tell people to tuck their elbows in and just like that. And again, it helps to avoid those coughing fits that we can get into going, which is very difficult. It causes us to use a lot of energy and then make us feel very tired. So try next time, if you are in the mornings, you can even try this, to use this huff coughing, those short bursts of coughs instead of a long coughing fit. So now that we've talked about some of the things that we can do if we have COPD, is how do you get diagnosed with COPD? So some of you on the call may have already been diagnosed. Some of you may just have been curious about what COPD is. So COPD is diagnosed with spirometry, and it's a simple breathing test that is performed it can be performed at a doctor's clinic. It's usually at a clinic or a hospital that they do these. And what you do is you perform this test, and then it gets to be read by a doctor, and then they can tell if there's an obstruction there that may be COPD. So I'm gonna try and get this video to work here of what is COPD. Can you see it on my screen? Sorry, Julia.
Hi. Yeah.
Can you see the YouTube video?
No, we're just looking at the how to get diagnosed.
Okay. So you can't see the screen. I don't know how to embed this. Sorry about this. There's technical difficulties.
If we can't get it working, we could always send it out with the recording, but not ideal.
So I can kind of, it's a video. I thought I could share my screen with it, but it's not going to let me, of what spirometry is. But basically, if you look at the picture that's on the screen, you'll see there's a hand device that you would hold into your hands, and a technician, generally a respiratory therapist or a nurse, would be directing you how to do it, and they're going to tell you to take a really big breath in and then blow out as hard and fast as you can, and keep blowing out till you can't blow it any longer. And again, this helps to tell us if there's any obstruction in our lungs, which can mean that you have COPD. So we can link the video maybe on the website, or it's under actually the National Lung Association is where I got the video from. So now that we've talked about some information, you might have more questions on, you just need a little bit more information. So primary care providers like your doctor or your nurse practitioner are great resources to ask questions for. We also have in PEI a COPD community program with primary care, where you can go and see a nurse and they will do COPD education with you, similar to what I kind of talked about today. They look to make sure that you're taking the right medications, that you're using your puffer correctly, that you are have had your spirometry done, and that you're kind of everything is going well. You can get a referral to the community education from a doctor or a nurse practitioner. There's also pulmonary rehab, which is, again, what my main job is. Right now, we are not running a program just because of COVID, but we're hoping to get that up and running in the new year, most likely as a virtual, just like we're doing today. And there we do education sessions like today, as well as provide information about exercise and how to stay moving and healthy, as well as the PEI Lung Association. So Julia has lots of information that she can give you. She can direct you to the website, but also if you don't have computer access or you just want some physical copies, she can help with that. So never hesitate to reach out if you're feeling overwhelmed and you're not sure, you just don't understand the lung disease enough. Make sure to ask the questions, because we want you to, the more informed you are about your disease, the better you are able to manage it. So to kind of wrap things up, chronic disease is a long-term disease that is associated with damage to our lungs. So it doesn't go away, but we can manage it by taking our medications as prescribed, exercising regularly, having a healthy lifestyle, quitting smoking. So those things can help slow the progression down and improve your overall quality of life. And that is it for today. Thank you very much for listening. So I think we'll stop the recording now. And if anyone has any